I'm not a doctor, but I play one on TV.
All right, welcome back into the Mark Cox Show. Glad that you're with us. I am not a doctor, but I've been friends with Percy Menzies for a long time, who runs the Assisted Recovery Centers of America. And there is a health crisis that we're facing, and we're coming into that time of year when it just gets exacerbated. And that's why I wanted to ask him into the studio today to kind of talk about this and make sure people know that there's help available out there. Percy, how are you?
I'm doing well. Thank you for inviting me back, Mark. I think we go back on almost 25, 30 years when you first talked to me.
Yeah, it's been a long time now, and I appreciate that you could make it in there with us. You mentioned to me that recently you got invited to speak at a local hospital to some social workers who come across a problem all the time that, a lot of us are maybe blind to if it doesn't affect our lives personally, and that's alcoholism. We're entering what you call the drinking season. So what was the message from these social workers that you spoke with?
Well, people don't realize that alcoholism is the second biggest killer of people after smoking. 88,000 people a year die from it. If you take a daily figure, that's one plane load of people crashing every day and dying from alcoholism or effects of alcoholism. And yet we seem to not really take it seriously. And we have known, figures have shown, that the drinking season really begins towards the end of October and goes all the way till the end of January.
Well, they say that the first step is denial, right? So a lot of people may be in denial, and then they realize, I might have a problem, but it's not as bad as so-and-so or somebody else I know. It's not as bad as them, and I can handle it. Here's an example. Just this week, you tell me, you had a couple of professionals come into one of your offices who happened to be police officers. To me, it's a perfect example of not that they're police officers, but that they are professionals who can't probably afford to take 30 days off or maybe 60 days off from their job to go into one of these outpatient facilities or inpatient facilities for alcohol treatment, which is oftentimes what people think is their only option. So maybe you can tell them what you do at ARCA that is different than that, and the kind of success that you've seen. Exactly.
Most people think that the only way to get treated is go away to some place, Arizona, California, Florida, for a month or two, and somehow you'll come back home miraculously cured. Magically cured. It doesn't work because the treatment has to occur in a natural environment. You should be exposed to the myriad of cues and triggers that have caused the problem in the first case, and that's what we specialize in. We send people back to work literally within a day or two of work, but they have to continue treatment for anywhere from 3 months to 6 months. What are the three benefits? One is there is no loss of income. More importantly, for professionals, there's no loss of confidentiality. It affects every segment of society.
Sure.
Physicians, airline pilots. You saw what happened last night. An airline pilot was found drunk getting onto an airplane. With all the thing, it was shocking that plane could have crashed. His alcohol level was twice the legal limit. This goes on and on. We have highly effective treatments that can be treated in the natural environment. These are anti-craving medications combined with counseling, with psychiatric help, and together 1 + 1 makes 3, and they do exceptionally well.
Yeah, I know that there's always a problem with people falling back into their old habits. One of the advantages here is that you're helping them defeat that craving. And this drug's been around a long time. Why hasn't it gained more acceptance than it has?
Because we continue to insist that alcoholism is a disease of hedonism, weak morals, weak willpower, and we get so upset about that. It has nothing to do with that. It has got a genetic predisposition. Nobody plans to be an alcoholic. Nobody plans to be a drug addict. Why do we condemn these people? Once it happens, you have treatment for that.
Right.
And the very nature of addiction is what? They have to hide it. They have to deny that. Denial is the armor that protects the disease. We need to break down those walls. And what we do at our clinic, for the last 16 years I've been doing this and telling them that we have highly effective non-addicting medications that gives the patient a fighting chance to do well. And why are people rejecting this is beyond me.
Yeah. I should point out that ARCA's, you've got two different offices, right? You've got the one down off Chippewas. There's a second location.
We have a second location on the cross on the between 64 and 141, just behind
Okay.
the Mercy Medical Building.
Right.
So we treat close to 500 patients a month, and come October, the alcohol problem occurs. And I'm trying to tell people that yes, alcoholism is a huge problem, but unfortunately it has been overshadowed by all the overdose deaths with heroin. It is also very tragic. But alcoholism still remains a major addictive disorder of this country.
And you said something to me the other day that surprised me, because I've often said I thought of marijuana as sort of a gateway drug to some harder stuff. You disagreed with that based on your experience in this business.
Absolutely. The gateway drug is alcohol. Once you start drinking, your inhibitions are gone. And then it goes to whatever it is. But this goes to opiates, it is cocaine, you name it. So a lot of people are focused on marijuana. Not that I'm a fan of marijuana, but the gateway drug has to be alcohol. Not
Wow.
only is alcohol. And we need to pay attention to that. Prevent the use of alcohol use, but if those people do get addicted, let them seek treatment. It's a very treatable illness, and the outcomes are significantly good. Better.
So when someone is in your program and they're on this non-craving medication to help them defeat this and overcome this problem, are they on that medication for the rest of their lives?
No, it's only for about 3 to 6 months, because you need that medication just long enough for the brain to rewire itself, learn the skills that are not now focused on alcohol. Because when you're using alcohol, everything that's become the center of gravity. This medication takes them away from it. And once your brain has been rewired, you learn the new skills, you need to get away from it. And being a non-addicting craving medication, there's no withdrawal symptoms, nothing to worry about.
That's interesting. Well, I appreciate you coming in. I mean, we need to raise people's awareness about it, because you said between now and Super Bowl Sunday is the drinking season where you don't have to go out of your way to run into an environment where you're going to have alcohol present, and if you already have a problem, that just exacerbates
Absolutely.
it, I'm sure.
The holiday parties, family get-togethers, goes on and on. Alcohol consumption increases by about 30% during this time.
Wow. Assisted Recovery Centers of America, Percy Menzies is our guest. Their phone number down there is 314-645-6840. If you want to call to inquire, maybe you just have questions about yourself or for a loved one, you can call. And I mean, it's completely confidential. They'll tell you whether or not they can help you or not. ARCA Midwest is the website, arcamidwest.com. 2 different locations, one down off Chippewa and another one out off of 141 there on Highway 40, sounds like. Percy, thanks so much.
Thank you for inviting me. Thanks again. I hope the message gets through to people.
Like to try to help people when I can. I appreciate your time.
Thank you so
All right,
much.
thank you. Thanks for your support. Percy Menzies from ARCA Midwest. And again, that phone number, 314-645-6840. If you got questions, call them and see if they can help you or a loved one if you find yourself in that situation. All right, I'm going